Hi there, welcome back to Hormones Simplified. So, today we're going to talk about how do we diagnose polycystic ovary syndrome and what is the essential difference between polycystic ovaries and polycystic ovary syndrome. Now, polycystic ovary syndrome or PCOS is one of the commonest endocrinopathies or endocrine related problems which affect women in the reproductive age group. It has become a very common diagnosis, especially in gynecology and reproductive medicine clinics. How do we diagnose polycystic ovary syndrome? And what are the symptoms that usually women have when they have PCOS? Now, the most common presentation to clinics include problems with periods, such as irregular periods or heavy periods. When I say irregular periods, it could be a long gap between periods, sometimes too frequent bleeding, and sometimes simply heavy, painful periods with irregularity of cycles. So there could be some cycles which are very frequent, while others which become prolonged, and usually bleeding only happens after 1 month, 2 months, 3 months, progressively worsening up to 6 months gaps between periods. So the irregularity of the cycle or infrequent bleeding is usually one of the commonest symptoms. The next symptom is hair growth on the body, and that's usually unwanted hair growth in areas of the body which is not desired. The commonest one being growth of chin hair. It could be growth over rest of the body, growth around the breast, abdomen, chest, and the rest of the body. Technically, this is termed as hirsutism. Besides the periods getting infrequent or the cycles getting longer, and besides the presence of hair, unwanted excess hair, there are a few other symptoms that women may experience. One of the common one is weight gain or inability to lose weight quickly. This usually affects most of the women who have PCOS. However, many women will not face this problem, and that's usually termed as lean PCOS when body weight doesn't become an issue. Acne or skin eruptions is another issue with PCOS. This is again linked to excess of certain hormones in the body, and just like the unwanted hair, many women will present with acne which become progressively worse as the condition progresses. These acne may be of severe variety and may need medications rather than day-to-day simple solutions to get rid of the acne. So besides the skin effects, besides the effect on the weight and the periods, which are the most common presentations, PCOS can indirectly have effect on mood. The weight gain, the skin issues can often then link to low mood or depression in many women who suffer from PCOS. Yet another complication of PCOS is inability to conceive quickly, which affects some women who have PCOS. And again, it's the infertility, or often better described as subfertility, lack of ovulation, which can again impact the psychological health, which can bring about stress, and that's usually another presentation of PCOS. How do we diagnose PCOS in terms of clinical investigations and making a diagnosis? Now, there are usually three criteria which are clinically used to make a diagnosis of PCOS. The first criteria, of course, is clinical symptoms. So, varying length of menstrual cycles, or infrequent periods, or lack of ovulation, which can be tested by urine testing, or often is apparent because of lengthening of menstrual cycle. So, gaps between periods, bleeding infrequently is one clinical factor. The other one to consider is effects on skin, such as excess unwanted hair growth or acne. This is one criteria. The second one is usually biochemical criteria, which means there may be evidence that one of the male hormones, testosterone, which is known as an androgen, is high on blood tests. This is a biochemical sort of criteria to say that there is excess of male hormone in the body. And of course, then you look at the ultrasound picture. which is does a pelvic ultrasound for the woman show evidence of polycystic ovaries? So it's usually infrequent bleeding, anovulation, or lack of periods. Secondly, effects on skin, as well as biochemical evidence that there is increased male hormone in the blood. And of course, third is the ultrasound criteria. You look at all these three factors together to then make a diagnosis whether a woman has PCOS or not. In usually what's followed is, if two out of these three criteria, the periods, the skin issues, as well as the ultrasound, if two out of three criteria are met, then usually it satisfies the clinical diagnosis of polycystic ovary syndrome. The important thing to remember here is that you can have PCOS without ultrasound showing polycystic ovaries. You don't have to have ultrasound diagnosis of polycystic ovaries to make a diagnosis of the syndrome. You can still have infrequent periods, you can still have hair growth on the body or skin issues, and that's usually enough to make a clinical diagnosis of PCOS. Of course, if you have polycystic ovaries on scan, then it adds to the diagnosis. Let's look at the PCO or polycystic ovary. What are polycystic ovary? Are they normal, or are they always suggesting that a woman has PCOS? From our current clinical knowledge, what we know is about 1 in 4 or 1 in 5 women, 20 to 25% of all women have polycystic ovaries. And when I say polycystic ovaries, that simply in common terms means bulky ovaries, slightly bigger ovaries, which have plenty of follicles, plenty of eggs on the surface of the ovary. Polycystic ovaries is a misnomer. We don't see cysts on the ovary. It is simply the presence of follicles or eggs surrounded by fluid which are on the surface of ovary, which actually got the name PCO because these follicles were mistaken for cysts. So polycystic ovaries simply means bulky ovaries with plenty of follicles on the surface of ovary. Now, these are normal. So if the woman does not have any other symptoms such as unwanted excess hair growth or acne or irregular periods, then having polycystic ovaries is completely normal. You would be having a normal menstrual cycle, ovulating regularly, and would not have problems with excess male hormone. So polycystic ovaries, PCO, simply means plenty of eggs, bulky ovaries. Now, if the woman then has additional hormonal issue due to excess of male pattern hormone, which is classical of polycystic ovary syndrome, then you have other symptoms like irregular bleeding or acne, then it becomes PCOS. So essentially, polycystic ovaries, plenty of follicles on surface of the ovary, no other clinical issue. PCOS syndrome develops when you have polycystic ovaries, but you have excess hormones giving rise to skin issue or menstrual irregularities. We'll talk more about all these issues in subsequent videos, but for now, I hope you found this video useful. All the best. Bye.